Welcome back. The FDA granted approval for the birth control tablet Opill to be sold over the counter. This marks the first daily oral contraceptive that can be used without a prescription. By approving this birth control pill, consumers now have the option to purchase this in drugstores, convenience stores, grocery stores, and online. Here to talk more about this is a Darney Landy Fellow at the American College of Obstetricians and Gynecologists, Dr. Kristyn Brandi. Doctor, thank you so much for joining us.
Thanks for having me.
Now, can you just explain what could have possibly sparked the FDA to make these changes to birth control access?
I think just hearing it from the overwhelming amount of people that want this over-the-counter access. So from medical associations that have been advocating for change, including ACOG, the American College of Obstetricians and Gynecologists, who for over a decade have supported having this available over the counter, as well as patients. People want this to be available so that way they don't have to go through the hassle or have to fight the barriers of accessing this through the traditional healthcare system.
Now, will the sale of these products be similar to what many of us know as Plan B? And if not, how is it different?
Sure, and I think it's important for us to explain what the difference is between these medications. Generally, emergency contraception or Plan B is something that prevents pregnancy in an emergency, meaning that unprotected sex. This is a pill that is used to prevent pregnancy on a daily basis. But even though these medications are different, hopefully they'll be marketed and distributed in the same way, meaning that you can go to your local pharmacy, your local grocery store, and be able to go buy them without a prescription in front of the counter, meaning that they're on shelves. You can just pick it up.
Now, I want to expand on that. The FDA also declared that Opill is not for use as an emergency contraceptive. Can you just expand on the importance of that and just making sure people understand what they're going to get when they go to these stores?
Definitely. And I think that's a common question because I think there's a lot of confusion and misinformation around emergency contraception in general. So emergency contraception is a medication that works to stop ovulation in the moment, hopefully within 72 hours of unprotected sex. That's something that you take only once in a while, typically when you need it. Opill is what we call a standard contraception or birth control pill, meaning that it's something that you take every single day to prevent pregnancy. And they work in different ways. Emergency contraception is a higher dose that blocks ovulation from happening, while the Opill or typical contraception can prevent ovulation, but these doses are a little bit smaller. And so typically it works by creating a barrier using cervical mucus so that sperm can't enter the uterus and the fallopian tubes to fertilize an egg. So they work a little bit differently, but they're still great tools to be able to have. And you can use them in combination if you need to. For example, if you forgot a pill during your Opill regimen and you had unprotected sex, you could use emergency contraception too. And so they're great tools for people to be able to have, and particularly be able to have over the counter when they need them.
Now, I understand that with Opill, a lot of stories are just making a point to talk about how it's an oral contraceptive. I kind of want to go into that. How does this differ from other birth control products that need prescription use? And is this the only one that's currently, I don't know if it's currently in stores, but is this the only one that's going to be in stores?
So it's very similar to the pills that I prescribe my patients every day for birth control. We have a version of this that's similar, that's by prescription, called the mini pill, which is something that is a progestin-only pill that people use every day. So there's not much difference chemically between this new pill and the pills that people get by prescription. The only difference is the way you get them. Having to go through a physician's office or a provider's office can be challenging for a lot of people, particularly people that have been marginalized in healthcare. And so it's really great that people can have access to this over the counter, be able to pick it up when they need it, whenever they need to start a new method. And right now, there's not a lot of options on the shelves currently. People have access to condoms, which are barrier methods, and spermicides that can prevent pregnancy. But this will be the first hormonal contraception that will be available on the shelves.
And can you talk more about the importance of access? Because you recently just mentioned, not everyone feels comfortable possibly going to their physician. Can you just talk more about that?
Definitely. And this is a really important point when we talk about this over-the-counter access to this new birth control. One of the benefits of that is that people that otherwise wouldn't be able to access this healthcare can now get this pill. So when I think about people that are marginalized and haven't had access or have had barriers to access, I think about young people, teenagers who historically have difficulty taking time off of school, getting transportation, having to pay for this medication potentially with their parents' insurance. It creates a lot of issues around confidentiality and privacy. And so many teenagers just don't get birth control because they're worried about their parents finding out. And so having access to this over the counter will be a great option for people. It's also helpful for people that otherwise are either skeptical of the healthcare system, rightly so, because historical sexism and racism and other oppression within the healthcare system. And so people can do their own research and find out if this pill is safe for them and be able to use it. And people that otherwise have barriers to care, people that have limited insurance that couldn't access a provider's office, people that, have to take off time of work and childcare and travel costs to get to their nearest provider's office. And so this is going to be a game changer for a lot of people that otherwise wouldn't have access to care.
Now, according to the FDA, almost half of those 6.1 million pregnancies in the US each year are unintended. How will access to birth control impact the work that many health professionals like yourself are doing in the field?
Well, I think initially healthcare providers were worried because people come in for birth control, and this is an opportunity for us to talk about other preventative measures, things like HPV screening, cervical cancer screening, breast cancer screenings, in my working as a gynecologist. But I think we've thought about this differently, and we don't want people accessing birth control and creating this requirement that people have to go in person to get it to be a barrier for people to access this care. I think for people that are seeking birth control and look through their options and decide that this pill is the right option for them, they can go get it. And I don't want to create barriers or a delay in them getting that care. But I hope that they come to me to get their other types of gynecologic care when they need it. But I know that many people aren't necessarily going to choose this particular pill or want to talk about it with their provider anyway, in the range of other options for birth control. And so I don't think people are just not going to come to the doctor's office anymore. I think people will be coming out and people seeking birth control. It'll just look a little bit differently. And people that want to come in will have that option. And people that don't will also have an option.
I also want to expand on that. Does it make, I guess, things a little bit easier? If, let's say you have a patient that has maybe an unintended pregnancy, and now because they have this access to birth control, does that make things easier on the health professional's part?
I think so. And I want to stress right now that there's a lot of crises happening currently in reproductive health care. There's issues around abortion access. There's issues around maternal health care, particularly Black maternal morbidity and mortality. There's a lot of things that we need to focus on right now, and we're still recovering after COVID. And so having people be able to access birth control and limit the amount of visits that they are taking into the healthcare system so it doesn't prevent other people from getting other types of healthcare will really help the burden of people that are really crunched right now, trying to take care of as many patients as we can.
Now, you kind of briefly mentioned it, but we saw the overturning of Roe v. Wade. Will this affect how these pills are distributed across the country? Would this be considered like a highly political thing now that it should be available in stores and grocery stores? Can you just tell me your thoughts on that?
Yeah, I'm getting more and more worried about this. I think because we've seen a lot of politicization of the healthcare system and reproductive health care, it's really great right now in this post-Roe world that people are going to have more access to things that prevent pregnancy, like this new birth control pill. It doesn't fix the abortion crisis that's happening right now in many states. And I'm concerned because we saw in some of the abortion bans, in some of the preliminary versions of those bans, language around banning contraception, particularly things like emergency contraception and IUDs, because people confuse that with abortion. And so I worry that while contraception is incredibly popular and people benefit from this both emotionally, personally, and from their health perspective, I'm really worried that this issue will be politicized and potentially in the future, there may actually be bans on this pill being over the counter and other contraceptions in the future.
Now, you just said something that I think is super important, that a lot of people often confuse birth control with abortion. And obviously, it's all a part of reproductive health. But can you just expand on, like why there should be an importance to understand that these are two different concepts?
Right. And I provide the spectrum of reproductive health care. And so I want to help people regardless of what they need. But it is important for people to know that contraception and abortion are different things. And when we say things like emergency contraception or using contraception to prevent pregnancy, that means that if you were to take these medications while you are pregnant, not only will it not work as an abortion, it won't end the pregnancy, but it's also safe to take in pregnancy. These are the same medications, the same hormones in very low doses that your body makes when you're pregnant at very high doses. So it's incredibly safe to take these medications. They will not cause an abortion if that is something that you're concerned about. But I do worry that all this care is really important and essential for people to access. And I worry about that politicization and the polarization of this issue because people just really, at the end of the day, need to get the health care they need.
Now, because this is over the counter, proper use is very important. Can you quickly just inform our viewers what they should keep in mind if they are interested in this birth control?
Definitely. And it's something that I counsel my patients on the exact same way if I was giving them a prescription for birth control. So this pill is something that has to be taken every single day. It lasts in your system about 24 hours or so. And so that's why it's important that you have to take it about the same time every single day. And that if you don't take it every single day, you may have a chance of getting pregnant. And so it's important to follow the instructions if you miss a pill. And if you miss a pill, you may not be protected. And so it's important to use condoms or another backup method if you're having sex and you don't think that you're protected from with your pill. Again, it's also something that doesn't protect you from sexually transmitted infections. And so it's important to use a condom or some barrier method to protect against sexually transmitted infections. And they work really well together. It'll increase your chance of preventing pregnancy if you use this Opill as well as using condoms. And lastly, that this works for the vast majority of people with really few side effects. The only contraindication or reason you shouldn't take this medication is if you have active breast cancer. And so if you have any questions, you can always reach out to your local provider and ask questions and feel comfortable taking this medication. But again, I'm really glad that it's going to be available so people can be able to use it whenever they need it and be able to access contraception.
All right. Well, thank you so much for joining us. We really appreciate it.
Thanks so much for having me.
If you or someone you know may be curious about this new form of birth control and may have some unanswered questions, please go to the FDA website, which you can see on the screen below, to find out more. And if you would like to learn more about the works of the American College of Obstetricians and Gynecologists, please go to their website at www.acog.org. Stay tuned, we have more open for you right after this.